Good morning, everyone. Welcome to an episode of Coffee Break with Card, La Hora del Cafecito's new sister show. My name is Olivia McDonald, and I would like to welcome you to our show. So Coffee Break with Card is a program dedicated to all of those in our community who are living with autism, to their family members, and to all of those who support them. So come on in, join our virtual table, and in the comment section below, let us know if you're having a cup of coffee or tea with us this morning. So in today's program, we will be talking about how culture impacts the autism diagnosis journey. Yazmin will also be sharing with us strategies that primary care, early education, and even early intervention professionals working with racial and ethnic minority communities can use and utilize. So join us, we have a lot to talk about. So let's start by introducing you to our coffee break hostesses for today. Yeah, as I already mentioned, my name is Olivia McDonald. I am a card consultant assigned to the early childhood team. I am a public health educator, the mother of a very active toddler. And also I have a younger brother diagnosed with autism. I'm joined this morning by my colleagues, Yazmin Castellano. Buenos dias, Yazmin.
Good morning, Olivia. Buenos dias.
And Maggie Aldana. Buenos dias, Maggie.
Good morning, Olivia.
As you know, Yazmin Castellano is an excellent professional in the field of mental health. She is a card consultant assigned to the youth group from middle school to young adults. And she is the mother of 3 children, one of whom is diagnosed with autism. Welcome, Yazmin.
Thank you, Olivia.
Maggie Aldana is an excellent special education teacher. She is the previous chair of CARD's constituency board and is the mother of 3, 2 of whom are diagnosed with autism. Welcome, Maggie.
Thank you, Olivia.
Obviously, Lourdes is not the one leading the show this morning. She is unfortunately not here today as she is out in the community delivering another training, but she will be back with us for the next episode. Before we get started, I do want to review the rules that we want to adhere to during this program to ensure a safe environment for all. So please remember to keep an open mind, a positive attitude, and respectful language. Yazmin, is there anyone in our audience that we need to say good morning to before we get started?
Not at the moment, Olivia.
Okay. So for those of you who are joining us a little later, again, in today's program, we will be talking about how culture impacts the autism diagnosis journey. Yazmin is going to be sharing with us strategies for primary care, early education, and early interventions professionals who are working with racial and ethnic minority communities. So let's get started. So Yazmin, my first question for you is there a racial and ethnic difference in the diagnosis of autism?
Yes, Olivia, there is. And according to the CDC, we have that the white community has the highest prevalence of diagnosis when it's compared with African Americans and when compared with Hispanics. Actually, Hispanics has the lowest prevalence of children diagnosed with autism. And also, I want to indicate that children with hearing loss at times are misdiagnosed with ASD, with autism, instead of being diagnosed with hearing loss or deaf or hearing problems.
Okay.
And another information is that hearing problems are at least 3 times more common in people with autism. Actually, according to the Gallaudet Research Institute, they estimate that the prevalence of autism among children that are deaf or have hearing loss is 1 in 59, and that was in 2019. So yeah, there is a discrepancy in the diagnosis of people with autism, other disabilities, and other cultures and minorities.
Maggie?
And Jasmine, I had a question. What are some of the challenges faced by the minorities that prevent early diagnosis of autism?
Well, there's a lot of research that has found that minorities receive lower quality of services related to healthcare than non-minority groups. Another challenges that minorities are facing is discrimination. Also, they are less likely to seek mental health services and treatment for different reasons. There's also the socioeconomic status. We have immigration status for those that are immigrants. And another thing is that each minority group has a different perception about the developmental milestones of their child. Some groups think that it is okay, for the child to be, I don't know, 2 years old and still not speaking or not walking, things like that. And the culture and the value systems prevents from parents to express their concerns to healthcare professionals. Healthcare professionals at times seems like a sign of authority, and they will not question nor they will express their concerns to the healthcare professionals because of shame.
I really like that you touched on how there's sometimes different perceptions with the developmental milestones, because I could definitely see in some cultures, eye contact, for example, that's like not making direct eye contact with elders is actually like a behavior that would be seen like, oh, they're being respectful, and they may not see that as the same way as maybe like in Western culture with eye contact being so important.
That is very true, Olivia, and that doesn't mean that, and we know that one of the signs or red flags for autism is the eye contact. Not because someone is not making eye contact means that, oh, he has autism, or the other way around, or is the child is making very good eye contact. However, oh, well, it doesn't have autism because he's making eye contact. So we have to look at the whole picture before providing a diagnosis and take in consideration the culture. Another thing is that the way kids interact, like here in the United States or even, in Puerto Rico, is a whole lot different from, other cultures, like the fact that we have a more active interaction with our kids, let's say like that. However, in other cultures, that interaction with the parents that doesn't exist. It doesn't mean that the child lack of social skills or is withdrawn from being social. It's just a part of his or her culture. It will be a sign of disrespect to have that, how would I say, a relationship with, like we have over here with their parents. It's just different. I'm not saying that they don't have a relationship with their parents and the adults. They do. It's just that it's different.
Right. And, speaking about culture, what are some of the common cultural challenges faced by minority groups?
Well, as I was saying, shame is one of them, and shame is one of the biggest one because it really prevents a lot from parents to express healthcare professionals about things that they're seeing that probably need to be addressed or require attention in terms of the development of the child. The shame of, if I tell the doctor that my child, I don't know, is 4 years old and still not potty trained, that means that I'm not a good parent, that I don't have it all together, that I'm not doing a good job. Child behavior is due to lack of discipline, so the fact that I've been referred for a mental health professional or ABA therapist, so the therapist can work with my child behavior, means that I'm not being a good parent. I don't know how to provide discipline to my own child. So there's a lot of shame. Denial is another one. No, my child is perfect. That doesn't run in my family. That doesn't happen in my culture. Lack of information as well, like, oh, in such and such country, you don't see that. That's just here in the United States or just here, so that's new. Like like a new trend, you know, because we don't see that where I used to live before on my home country. So machismo is another challenge, and family won't seek help due to shame and denial, like I was explaining.
Okay. I think too, like sometimes it's I could see sometimes the culture of the primary care provider or the person that the family is also interacting with. I know that was an issue with my brother, was when we were in France, was there's a lot of shame around mental health, and around developmental disabilities there, and that was an issue with him and my parents having like a good conversation and getting early identification for him.
Yes, that's one of the biggest how would I say, challenges, the shame, and they try to keep everything quiet, you know, everything, they get judged by family, judged by the community, so and themselves, you know, their own like parents, as parents, you know, their own confidence also shakes the ground. And for the dads, and the machismo is like, you are not man enough to bring a child that is healthy, you know. So it's like, what's wrong with you? What's wrong with your sperms that are not, you know, strong enough to bring a child that is healthy and all that? So, and a lot of pressure from you know, for the dad and peers.
Maggie?
This is such great information that you're bringing us, Yazmin. Is there anything else that you want to share with our audience?
Yeah, I want to share with the professionals. So what to do? What are some suggestions? What can we do? So first of all, let's educate ourselves. Let's participate in trainings about autism. We provide those trainings free of charge. Just give us a call, contact us, and we're very flexible as well. Also, learn about cultural diversity, learn about equity and inclusion and what it means. I mean, inclusion, it doesn't mean that, oh, I have someone with me, working with me that has a disability. At least, you know, I'm being inclusive because at least I have someone. Look, you know, he's putting the red button, you know, on this basket. So I'm being inclusive. No, it goes above and beyond that. So let's spend time with the minority community. Also, in your community, in the area where your community is at, and you're providing services at, learn your community. What is the minority population that you're having? Are they Hispanics? If they are Hispanic, where the majority coming from? Are they coming from the Caribbean? And they coming from Central America, from South America? We are all different. Are they more from India or the Eastern? I mean, where are they coming from? What are their needs? What are their challenges? What is their culture? So let's learn about that. And let's practice empathy. Empathy is listen, open-minded, listen, put all your thoughts and what you think you know it all, put it aside. Just sit down and listen and validate parents' concerns and feelings.
Yeah. Well, thank you. Yeah, thank you for saying that. I think that last point especially really resonates with a lot of things that we hear from our families. It's just wanting to be listened to. So for those of you who are watching, if you have any comments or questions, please let us know in the comment section below. Even if you're watching this after we get off the air. So we will be answering those questions and comments through the comment section, or possibly through in another program. And if we do use your comment in an episode in the future, we will be sure to give you credit on the air for coming up with the idea. So we're almost at the end of the show, but I didn't want us to leave without, first of all, again, thanking Yazmin for bringing to our audience this information. Thank you so much.
You're welcome.
I also had a couple of points I wanted to touch on. I wanted to remind you all that, again, Coffee Break with Card is airing every 2 weeks instead of every week. So October is Sensory Processing Awareness Month, and we will have episodes on October 7th and October 21st on related topics to this month, to next month's theme. I did also want to let you know that October 1st, we are going to be joining forces with other organizations to bring you Cards Arts in the Park event at this year's Yes Fair. We have already uploaded the flyer and have begun to sign up exhibitors. If you have, if you are a therapist or you are a business, an arts organization, or arts business, and you would like to donate 1 or 2 20-minute adapted art or movement activity, really workshops or classes at this multi-exhibitor event, please be sure to contact Lourdes at lourdesq@usf.edu for more information. In exchange for your donation, you will be able to set up a table to share information about your organization with numerous families, caregivers, and providers of services, all the others who are going to be gathering at the event. Space is limited and we are filling up quickly, so please contact her soon if you are interested. So this all brings us to the end of the show, but before we go, we do want to ask for you for that little favor that we ask every time. We are going to be placing a link in the comment section below so that you can evaluate us and let us know if you find value in what we're doing. It's short 6 questions, so please, and we have to ask this every single time, so please go ahead and click on that link and complete those for us. And also, please don't forget to give us a like, share this video on your page or with someone you think would find this information valuable, and meet us here every other Friday at 10:45 a.m. so we can spill the beans on important topics related to autism as we drink coffee or tea with you. So until then, we wish you good vibes and hot coffee. Thank you, everyone.
Thank you.
Bye.
Bye.
Bye-bye.